Hi, my name is Greg Fell, I'm Director of Public Health for Sheffield, and this is a situation report dated today, the 1st of March. Three main things. Firstly, the epidemiology. Secondly, where we are with regard to lockdown. And thirdly, back to school. And then I'll touch on vaccination at the end, actually. So epidemiology, so the lockdown, we're currently still in lockdown, and that is having the impact that it was predicted to have. And it's certainly holding and is definitely reducing rates across Sheffield, and that is good news, clearly. So rates as of this morning are currently in the order of 120 per 100,000. Most importantly, and we'll shift in this direction, but the over 65 rate continues to fall and is falling really quite quickly now. Some of that is the impact of the lockdown, but a significant chunk of it is the beginnings of the protection from vaccination. So I increasingly will start looking to the over 60s rate as the key metric, not the whole population rate, though both are continuing to come down. I think the whole population rate will probably stabilise somewhere about where it is now, actually. The rates are still, whilst they're going down in most age groups, they're just beginning to tip back up a little bit in the working age population. It's a group that are out and about, they're at work. So if you're out and about and meeting and interacting with other humans, then there is a chance of infection. So we're a long way from out of the woods, though the situation is improving and continues to do so. Again, some geographical concentration in the east of the city. There are more people in the east of the city that have the type of jobs that you can't do from home, and as a result, there'll be more infections. The key area of transmission is the household, and it's one of the reasons why we are not encouraging people to mix from one household to another household, because that's where infections can transfer from one network to another. There's lots that people can do to limit infection within a household, and I've covered that on the previous video, but also to limit infection between households. So that remains the key issue and the key risk. But all epidemiology-wise, headlines are that R naught is below 1, not terribly far below 1. I prefer it to be much less than it is. It's probably about 0.8. The lockdown has achieved the job that was expected of it. Cases are fairly unevenly spread across the city, and are actually going up in some working age groups. And I think we'll all continue to need to be careful for some considerable time to come. Back to school is the next area. So, and I know parents, carers and children might be feeling anxious about the return to school from the 8th of March. It's worth me saying that schools across the city are doing everything they can to keep children safe, and the risk to children from coronavirus is vanishingly low. I should say thank you to everyone who's been homeschooling for the last few weeks. It's been hard, and to schools who have been open for children of key workers, and that has also been hard, and thank you to those who've worked throughout in schools for that. So what can children expect when they go back next week? We've updated our webpage. There's lots of information on the webpage, and I'll go through some of the key points. Firstly, parents will be contacted by email to tell you when your child will be returning to school, and that's important because schools will return on slightly different dates depending on some of the arrangements that are in place in each school. Testing is the first change. So the biggest change will be testing for secondary school pupils and staff who are not showing symptoms, so-called asymptomatic testing. It's voluntary, but I'd encourage everyone to take part because it helps identify more cases and breaks more chains of transmission and keeps schools even safer. So primary school and nursery age children won't have to take part in the testing programme, but staff working in those settings will be asked to. So again that's voluntary, but I'd encourage everyone to take part because it helps reduce the risk even further. Details of when and how that will work will be on websites. It's important to note that these are tests for those who don't have symptoms. If your child or you or anyone in your household has symptoms, they should self-isolate immediately and book a test for those with symptoms, which is known as the PCR test, and they can call 119 or go to the nhs.uk website. Face coverings is the second area of change. So secondary school pupils will be required to wear a face covering unless they're exempt in classrooms and during most activities, unless it's possible to socially distance. And they should also wear one when moving around school buildings, such as corridors or communal areas where distancing can't happen readily. Some things will stay the same as before. School bubbles will continue. There'll be staggered start and finish times. If needed. Social distancing will be in place wherever that's possible. Regular use of hand washing with soap and hot water or hand gel. Enhanced cleaning and ventilation will continue to be in place. And the same guidance around what to do if a staff member or a pupil shows symptoms and or test positive. Those things will remain unchanged throughout. The web page has information on shielding, self-isolation, school transport, holiday, travel and attendance. So do give it a read. There's an awful lot of information up there. Vaccination is the last area of this week's update, and again that continues to go at some pace, and it's going very well. Obviously, it's great news that the Joint Committee on Vaccination and Immunisation has confirmed that those people on a GP learning disability register will now be eligible for a vaccine. So it's important that if you have a learning disability or a member of your family has a learning disability, they're registered with a GP, because otherwise they won't get an invite automatically. We do want everyone to be vaccinated as soon as they've been contacted by the local NHS. It's important that you do get vaccinated, but if you are showing any symptoms of coronavirus and or are self-isolating or are awaiting test results, please do not attend for a booked vaccination appointment, because you must stay at home. So be assured that your appointment can be rearranged and will be rearranged, but it's really important that if you are supposed to be isolating or at home because of symptoms, then you shouldn't attend a GP surgery even to receive a vaccination. Do remember that after your jab, it takes about 3 weeks for the vaccine to become fully effective, and you will need your second jab. It's really, really important that you attend for your second jab when that appointment comes sometime down the line. So in the meantime, please continue to do as you have been. Keep your distance, wear a face mask, wash your hands. Lastly, the census 2021 census is here, and it's really important that you fill in the census form when it arrives. Helps vital services and charities in Sheffield get the funding and support they need, and I've filled my census in, and when yours arrives in the post, please fill that in too. Thank you.